If you're enrolling in Medicare Part B after turning 65, and you're coming off a group health plan based on your current employment or your spouse's current employment, you need to know how to fill out Form CMS-L564. Coming up next, we'll show you how to fill out the form without any mistakes. Be sure to watch our previous video, How to Complete Form CMS-40B, which enrolls you in Medicare Part B. But you need both Form 40B and Form L564 to complete a Special Enrollment Period application for Part B. We'll link to that at the end as well as in the video description below. Now remember, a Special Enrollment Period is when you're beyond the 7-month initial enrollment period for Medicare and you're coming off a group health plan through your employer or your spouse's employer. To avoid a late enrollment penalty, you need to submit the application while covered on the group plan based on current employment or during the 8 months immediately after separating service from the employer. You need to submit both Form 40B and Form L564 to your local SSA office to apply for Medicare Part B in this scenario. Both forms can be downloaded from ssa.gov/forms. Here's Form L564, the Request for Employment Information. There are 2 sections, Section A and Section B. Mistakes are commonly made in a few spots, which ultimately delays the processing of your application. Here's how to get it right. An important note, you need one form for each person enrolling in Part B. So if it's a married couple signing up at the same time, both need a completed Form L564. Yes, even if one spouse is not working, the non-working spouse's coverage is through the working spouse's employment, so Social Security needs verification of the insurance coverage dates for each person. Alright, Section A says it's for you to fill out, the person signing up for Medicare Part B. We commonly see the employer fill this out for the applicant, but you surely can complete Section A ahead of time or after you get it back from the employer. For number 1, enter your employer's name. Number 2 is the date Section A is completed. Number 3 is the employer's address. Numbers 4 through 7 are where mistakes start to crop up. Number 4 is the applicant's name. It's the person who is applying for Medicare. Number 5 would be the applicant's Social Security number. Then number 6 is the employee's name, which could very well be the same person listed in number 4. That would be the case if you are both the Medicare applicant and the employee whose employment the insurance is based on. You should just duplicate the information in numbers 4 and 5 for numbers 6 and 7. However, if the applicant is the spouse who is a dependent on the insurance, then the applicant's name and the employee's name will be different, as well as the Social Security numbers. Alright, so that's Section A. Be extra careful to get the applicant and employee names correct. Let's look at Section B, which is definitely completed by the employer. Number 1 should obviously be marked yes, otherwise this form won't work. Number 2 is commonly goofed up. The question says, give the date the applicant's coverage began. It's not perfectly obvious what they mean, so we have added context with some additional wording that says, original insurance coverage start date through employer. This makes it more clear that the form is looking for the month and year that the applicant started health insurance through the employer originally, not when health insurance coverage started this calendar year. That's where employers go wrong on this form. They put in, say, January 1st of this year when benefits renewed. But that's not what is being asked here. It needs to be the original insurance start date through the employer. An additional note on this, if you've had group health insurance through multiple employers since turning 65, you'll need a Form L564 for each employer. And as long as the dates go back to at least when the applicant turned 65, and there isn't a gap in coverage of more than 8 months, you're fine. Okay, let's move on to number 3. Number 3 is asking if the health insurance coverage has ended as of the date this form is filled out. If it already has ended, then answer yes, and then number 4 should be answered too, the month and year the insurance coverage ended. But if the coverage is still active as of the day this form is completed, then number 3 should be answered no, and that means number 4 can be skipped, or you can write in NA. Now we move on to number 5. When did the employee work for the employer? The from spot definitely needs to be answered. The date the employee started working for the employer. As mentioned above, you might need more than one Form L564 if you had more than one employer since turning 65. So answer the from date for sure. Now you will either put in a date in the to spot or the still employed spot. If you already separated service, then use the to date. If you're still working there as of the date the form is filled out, then enter the current month and year in the still employed spot. So for number 5, you'll use 2 out of the 3 spots, the from date and to date, or the from date and still employed date, not all 3 dates. Number 6 is more rare, so we'll skip that, and we can also skip the hours bank arrangement section, as that is even more rare. Now we're just left with the very bottom section, which is where the employer representative who filled out the form will sign their name, add the date, their title, and phone number. So it's not a particularly long form, but it does have a few spots that can really create some issues if you don't know what the form is truly asking. Now that you know how Form L564 needs to be filled out, you can combine it with your already completed Form 40B to officially enroll in Medicare Part B without a penalty when coming off a group health plan. When all is said and done, be a walk-in at your local SSA office and submit the 2 forms to get Part B for your desired start date. Do this in the 3 months prior to the date you want it to start. Hey, as I mentioned earlier, be sure to watch our companion video right over here. It's called How to Complete Form CMS 40B.